Hi, today we're going to be talking about the stethoscope. The stethoscope was invented in 1816 by Rene Laennec. Prior to the stethoscope, doctors and nurses would use percussion technique to diagnose patients with abnormalities. When he first invented the stethoscope, he was assessing a patient, a young woman that had a heart condition, and she was very modest, and she did not want him to do the percussion technique because that would require him to put his ear against her chest. So he took a piece of the table paper and rolled it up very tightly, and he placed it against her chest and his ear at the other end, and that was the start of the stethoscope. Now the stethoscope has been modified significantly since the first original one, which would have been a long wooden tube. In the 1850, that's when the pliable tubing was introduced. And I'm going to go over the different parts of the stethoscope. First, you have the black pieces up top, which are the earpieces. They're made out of rubber. And then connecting those are the ear tubes. They're made out of metal. And they connect the earpieces to the acoustic tubing, which is a pliable tubing. And then all the way at the end, you have the chest piece, which is made out of metal. And it also has, well, a lot of them also have a piece that is called the chill ring, which is made out of like a harder type plastic. And that prevents the metal from being so cold when touching the patient. When you are using a stethoscope, first you will want to place the earpieces into your ear and slightly turn them towards your nose. And this helps eliminate any external sounds and will transmit better sound to the doctor or nurse's ears. And you would take the chest piece and place that. It's recommended that you place that directly on the patient's skin without any clothing in between. And then you want to take the lateral part of your index and middle finger, and that way you can press firmly against the patient. And this will transmit better sound for the doctor and nurse. Now you have two pieces on the chest piece, which the larger flat part is called the diaphragm. And this is used for more high frequency sound, which would be like listening to the heart sounds or lung sounds. And then you also, on the other side, you have the bell, which is a smaller side, and it's kind of dipped in. And this is for the lower frequency sounds, which would be like the bowel sounds or trying to diagnose a heart murmur. If you want to switch from one to the other, you would turn at 180 degrees and listen for a clicking sound. And then while you have this stethoscope in your ears, you would tap to make sure you're on the right side that you need to use. The stethoscope is commonly used for checking a patient's blood pressure. You also will have the doctors listen for heart sounds or lung sounds, bowel sounds, and that helps them document like rate, rhythm, the quality of the breaths, or any abnormal sounds in the heart, like which could be a heart murmur. Although technology has increased recently over the years, the stethoscope is still very commonly used every day with doctors and nurses. So the stethoscope will probably be used for years to come, and it's a great piece of equipment for the medical field. Okay, so I'm going to now scan the audience again, and I hope you enjoyed my presentation. All right, have a great day.